medical system in the facility that you work in. Keep the patient lying down and quiet. Position their feet and legs a little bit higher than the heart unless it's contraindicated by specific injury. This improves the circulation to the vital organs of the heart and brain. Do not give them anything to eat or drink, but offer reassurance and stay with the patient until professional help can arrive. You may be asked to stay on to monitor the pulse, respiration, and also blood pressure if you've been taught how to do that. Another type of alteration is in respiration. Respiratory distress or respiratory failure occurs when breathing is insufficient to sustain life. Many who are at high risk for developing respiratory distress and failure are patients who are immobile and those who are on bed rest for long periods of time. Other folks that are at high risk are people who have heart disease, lung or pulmonary disease, and those that are profoundly obese or heavy. Signs and symptoms of respiratory distress and failure include an irregular chest movement. That means that there can be fast followed by slow respiration. It might mean that there is an irregularity in symmetry. One side of the chest is moving when the other one may not be. There can be abdominal breathing, meaning instead of the chest rising up and down, there may be in and out of the abdominal muscles instead. There can be wheezing, shortness of breath, some unusual skin color might be gray, dark blue, gray, pale, dusky, and a change in mental status. When there is not enough oxygen getting to the brain, there is going to be confusion that occurs to these folks. You as a caregiver have responsibilities. Initially, raise the head of the bed. Some patients like to sit up and lean over an overbed table if they're having difficulty breathing. This allows the chest to expand and makes breathing easier. Encourage breathing exercises. We talked in another lesson about coughing and deep breathing, as well as the use of an incentive spirometer. Most patients with respiratory failure have serious anxiety. Difficulty breathing can cause a lot of distress. The entire focus is on taking each breath. So they need to have lots of reassurance and support from you, the caregiver. Provide care in a calm, quiet manner. Working quickly and making lots of conversation with the patient adds unneeded stress and also increases the breathing difficulty. Monitor for any color changes. In a light-skinned person, the skin should be pink, indicating an adequate supply of oxygen. The skin, nail beds, and inner lining or mucous membranes of the mouth and lips are indications of how well a patient's body is using oxygen. The color of these areas should be pink when circulation is good. In a dark-skinned person, you will look at nail beds, the mucous lining of the mouth, and lips to determine how well the patient is using oxygen. And that's because the evaluation of the skin in a dark-skinned person is more difficult. Cyanosis is a term used when oxygen content is very low in the body. If a light-skinned person has cyanosis, the nail beds, mucous membranes of the mouth and lips have a bluish or grayish blue tone to them. Cyanosis in a dark-skinned person will appear ashen or gray color, most easily seen in the nail beds and the mucous membranes of the eye and the mouth. A person who has respiratory failure will require some extra tests. One of these special checks is called a capillary refill test or a neurovascular check. Checking the capillary refill is a quick, easy, and painless test to evaluate how well oxygen is getting throughout the body. It may be done on fingers or toes of the patient. You would first want to remove any nail polish, as it will interfere with the ability to evaluate circulation well. Press the nail for a few seconds until the skin underneath blanches or turns white. Release the nail and evaluate the time it takes for the skin to return to its normal color, counting 1 1,000, 2 1,000, 3 1,000 to yourself may help. With normal oxygenation, this will occur within 2 to 3 seconds. Delayed capillary refill of greater than 3 seconds indicates a problem with the oxygen delivery. Pulse oximetry is another simple, painless test to determine how well oxygen is being carried in the body. The pulse oximeter is an instrument that measures the level of saturation of a patient's hemoglobin with oxygen. Hemoglobin is the part of the blood that carries oxygen to the cells. Pulse oximetry will detect any critical changes in a patient's oxygen level before skin color changes are evident. This makes it a valuable tool that provides details about changes in a patient's condition immediately. The patient outcome, of course, is better when early diagnosis is provided. The pulse oximeter sensor can be applied to a variety of places. For example, it could be attached to the toe, a finger, the bridge of the nose, or on the earlobe. The finger is the most common one for application of the sensor. Now I'd like you to watch a demonstration of using a pulse oximeter. Assemble your equipment. Remove any nail polish, as it will interfere with the ability to evaluate the patient. Attach the sensor securely, or reading will not be accurate. Also, be sure that the patient holds their hand still and that the finger is not cold. If it is, move to a different location. Make certain that the sensor unit is connected securely to the cable on the pulse oximeter. Turn the unit on and note the percent of oxygen saturation. Report your results to the nurse. A measurement of 95 to 100% is considered normal. Readings below that suggest a lack of oxygen to the tissues. Oxygen is necessary for life. Some diseases and conditions prevent the body tissues from getting enough oxygen, so supplemental oxygen is administered. Oxygen is a prescription item, which means that a physician needs to order it and provide the necessary means to administer it. A respiratory therapist is a healthcare professional with special expertise in treatment of respiratory diseases. He or she assesses the respiratory needs of the patient and makes recommendations to the physician for special treatments, medication, and oxygen therapy. The nurse and respiratory therapy hold the responsibility for setting up the oxygen equipment and